All right, passing the NCLEX isn't just about memorizing more. It's about mastering what matters and what can actually be tested on the NCLEX-RN exam. Hey guys, I'm Dr. Busti, your faculty and host on This Is Why, a show that helps healthcare professionals transform their medical knowledge from the what to the why. I suspect one of the questions you might have right now is, why should I listen to you, Dr. Busti? I get it, and I might be a physician and a pharmacist, but I started my career in healthcare as a registered nurse. That means that I took the NCLEX-RN myself and passed it on the first attempt. Since then, I have been involved in nursing education for over 30 years. So I've taken a lot of exams and I've noticed a common theme in all of them, which is part of the reason for doing this episode. As such, I want to help you see how you can maximize your studying so that you increase the chances of success. One of the things that matters is understanding how to identify high-yield, testable concepts that the people who develop the exam can actually score or count. This insight separates those who are first-time test takers and pass from those who need to retake the exam. Remember, our goal is to learn to study smarter, not harder. Now, if you're like many people who have ever felt literally overwhelmed by the sheer volume of nursing content, this lecture can serve as an initial roadmap. I explain how topics make it into that final exam. This perspective is important so that you can focus your energy on what's most likely to appear and increase those chances of passing on that first try. All right, so let's talk about the process for developing the NCLEX-RN exam, which then will give you that framework, okay, for what kind of questions should be then put inside that framework to be tested. So the NCLEX-RN is developed by the National Council of State Boards of Nursing, NCSBN. Each exam is roughly developed every 3 years. Why? Well, the reality is things in clinical practice change, and so therefore does the exam. Okay, so here are some of those key steps. One of the first is to complete what is called a practice analysis. This is done by surveying newly licensed registered nurse to identify those activities performed, listen, at an entry level of practice. The survey asks about knowledge, skills, and abilities, sometimes referred to as KSAs, to ensure that the content reflects real-world, safe, and effective nursing practice at the entry level. This means, guys, the current exam that you are going to prepare for or are taking is reflective of a prior practice analysis and survey. Now, once that analysis has been done and a framework has been created, well, the next obvious step is that the questions need to be put on the exam and validated. This is a multi-step process that can take months and sometimes years. This is where subject matter experts who represent nursing from a diverse group of backgrounds who write and review questions. Well, then those questions have to undergo internal review and then actually have to be tested in a real environment. So those questions are then placed on actual exams as unscored items. This is done to assess the validity, the reliability, and fairness. It also gives the committee the opportunity to review for any cultural or regional biases. Well, this means that some questions on your exam will be unscored to accomplish this. Now, you're not going to know which ones count and which ones don't, so you just need to answer all of them as if they all count, right? So why does this perspective matter? It matters because nothing new in the last 12 to 24 months will be tested. It takes about that long to get new content to be validated and scoreable according to or towards your exam. It also means that the exam only reflects, listen, only reflects the standards of nursing practice around the entire country versus maybe things that you learned at your school, your local hospital, clinics, which can sometimes be impacted by geographic or regional influences. Thus, brand new content, new guidelines, brand new drugs, topics still being debated won't be there. You shouldn't waste your time studying it for the exam. Now, is some of that clinically relevant? Well, of course, absolutely. Things continue to evolve, but it's not testable. So instead, spend time solidifying your core knowledge and understanding why you do what you do as an entry-level nurse. Now you might be asking, okay, that's great. I'm all good for studying less or only what I need to pass this test. But the content, what content does that still represent, right? I haven't taken the exam. I'm still not an entry-level nurse. Questions you might be asking of yourself, and they're good. So first, you need to evaluate the NCLEX-RN study guide and exam content outline. This gives you a breakdown of the objectives, but also the distribution of questions. But one of the things that you're probably going to note as you read each of those domains and objectives and things that they are holding you accountable for is that they're very vague in many places. You're not going to find what drugs you need to know, what disease states, what labs, and all that stuff's outlined. So that's why it can feel overwhelming. So what are you going to do? Well, you need to find one or two references or resources that point you in that right direction. You want to use resources that have been developed by people who have been using and doing this kind of stuff for years and understand what is actually important. And this is one of the reasons why I developed high-yield med reviews. Students kept asking me, despite having resources, how could they learn more to understand why they do what they do so that they're not memorizing content. So I developed a Q bank for them in part for that reason. And why does a Q bank or a test bank matter? Because you need to be practicing what is expected of you. What's expected of you is to answer multiple choice questions and apply your core knowledge. So you should be answering hundreds, maybe even thousands, of practice test questions. Because listen guys, no one has the exam. There's no book, there's no lecture, there's no course that has the answers to the test. They may teach you core knowledge, okay? And that's what you have to practice applying, because if you know the core knowledge and content and concepts, you'll be able to answer any questions given to you. Well, I hope that you found this topic review helpful and relevant as you begin to prepare for your exam. I'm Dr. Busti, and this is why we're here, guys, to invest in each other by helping medical professionals understand the why so that you can master the how. And the how in this case is how to study and pass the NCLEX-RN on that first attempt. We'll see you next time.